I'm Nima Rajan, and this is Forum Daily Week in Review. People from 172 countries attended the International AIDS Conference in Montreal, which wrapped up yesterday. The event helped highlight the enormous progress that has been made in HIV research and treatment technology. At the conference, Canada announced its own investment of nearly $18 million to expand access to HIV testing in the country. However, advocates say that a lot more is needed. This comes as a growing number of people in Canada are affected by HIV. In fact, the number of people living with HIV in Canada has risen by 25% since 2008. Well, joining us now to give us more understanding into what we know so far about HIV and treatment in Canada is Dr. Abhishek Rout, Medical Director of Apple Tree Medical Group. Dr. Rout, welcome back to Forum Daily.
Great to be here to discuss this very important topic.
Definitely. Now, let's start with what we know so far about the HIV virus in terms of how it's transmitted and how it affects the human body.
All right, so HIV, or human immunodeficiency virus, it's a virus that attacks cells that help fight infection in the body, so making a person much more vulnerable to infections and diseases. It's really spread by contact with bodily fluids of a person with HIV, most commonly during unprotected sex or through sharing injections or drug equipment. What we do know is left untreated, HIV can lead to a disease called AIDS, which is acquired immunodeficiency syndrome. The human body can't get rid of HIV. There's no effective cure that exists. So once you have HIV, you have it for life. Globally, approximately 1.5 million people were infected with HIV just last year, and estimated 650,000 deaths were linked to AIDS.
And what are some things that are still not known about HIV as we continue to research it?
Right. So there's a lot of things we still don't know. We don't know how to create a vaccine to combat. We don't know how it's able to evade our immune system. But if I were to focus on one thing, it's this: 1 in 4 people with HIV don't know that they have HIV. So in Canada, that translates to about 17,000 people. And since nearly 1 million still die each year from the virus, knowing that status is a huge improvement. And we're looking to really target on getting people to know their status here.
Well, it's good news that Canada is expanding testing of HIV. Now, we know one of the top concerns around HIV, as you mentioned, is developing AIDS. So what do we know so far about how and why this happens?
Right. So if you have HIV, but you're not on any form of treatment, eventually the virus will weaken your body's immune system enough and you'll progress to AIDS. Now, AIDS is basically the late stage of the HIV infection, where the immune system is incredibly badly damaged because of the virus. So at this point, you have a very weak immune system, and any infection can be life-threatening. Without that HIV medicine in general, people with AIDS typically survive about 3 years. And someone with a dangerous opportunistic infection could survive only about 1 year.
Now, staying on the issue of treatment, we mentioned the number of people with HIV in Canada has risen. As I mentioned, it was risen by 25% since 2008. So what kinds of treatment or treatments does Canada offer to those with HIV?
Right. So Ottawa estimates that we're looking at approximately 63,000 people living with HIV in Canada. The mainstay treatment is antiretroviral therapy, which really focuses on targeting the virus and bringing down that viral load. So people on ART take a combination of antiretroviral medications. Oftentimes 2 or 3 different HIV drug classes are used to bring down the viral load there.
All right, Dr. Rout. So can people with HIV live a normal and healthy life as long as they have access to such treatment?
That's correct. So people can live quite a long and healthy lives. Nearly half of the people living with HIV in Canada are aged 50 and older. And what we do see is HIV still acts as a very inflammatory marker. So even though we are living longer, what we do find is cardiovascular disease, diabetes, kidney disease, and cancers are more likely in the HIV population.
All right, Dr. Rout, about a minute left here, but one of the main issues around HIV is the stigma, the social stigma associated with it. So what kind of steps can parents take to educate their children about HIV?
I think what you mentioned was exactly correct. I think it's a very tough subject for parents, guardians, and caregivers to really discuss with their children, and it is because of that stigma. I think the most important thing to fight stigma and to deal with the issue at hand is really to have the education on it. Many parents are uncomfortable because they're not sure of the issues themselves. So the most important thing here is for parents to educate themselves using credible websites like the CDC, for instance.
All right, Dr. Rad, always great having you on Forum Daily. Thank you again for another informative interview.
Thanks so much for having me.
Up next, we'll hear about the International AIDS Conference from Mr. Gary Lacoste, the Executive Director of the Canadian AIDS Society. Stay tuned. The International AIDS Conference wrapped up today at Montreal's downtown convention center. More than 9,000 delegates from around the world were scheduled to attend the conference in person, with another 2,000 registered to participate remotely. Yesterday, Federal Health Minister Jean-Yves Duclos announced the government is investing nearly $18 million to expand access to HIV testing in Canada. A coalition of advocate groups says that Ottawa needs to do even more. They note the number of people living with HIV in Canada has risen by 25% since 2008. Well, joining us now to talk more on this is Mr. Gary Lacoste, Executive Director of the Canadian AIDS Society. Sir, welcome back to Forum Daily.
Thank you. How are you doing?
I'm doing great, sir, and we really appreciate you joining us. We know you're just coming back from the conference today. So what was this year's theme at the conference? What were the main points discussed today?
Well, the theme was re-engage and follow the science. So it was really a privileged place to re-engage with our peers across the ocean and around the world, and it was really interesting to re-engage our partnerships and also our knowledge base of what's happening around the world and cross-pollinating our way forward.
And we mentioned Canada has seen a 25% increase in people living with HIV since 2008. So where does Canada stand in terms of people with HIV compared to other countries?
Well, we're the country in the G7 that's lagging the most concerning HIV. So that's where we're starting from. And that's where the minister did not acknowledge with his announcement yesterday where we are. So we find it very disingenuous from the public health agency officials that are here, all the way up to the Minister of Health, and even by no ministers or the Prime Minister being present at the opening ceremonies, which they were contractually obligated to do, was very unfortunate because we've been trying to explain that to many delegates, and it's just egg on our face, and that whole issue resides on the shoulders of Justin Trudeau.
And on that note of the Minister of Health, we mentioned the announcement on expanding access to HIV testing in Canada. So just how accessible is HIV testing in Canada, especially for those most affected?
It's a patchwork quilt across Canada because we're a federation. So when it comes to HIV testing, we have to have many technologies that are offered so that people can reduce the barriers to testing. It's not just self-testing. And if you'll notice, in the investment, half of the money is going to the national laboratory in Winnipeg, which is staying internally in the government. So it's not reaching our priority populations that way at all. So we're asking for better technologies, not just self-testing, but wraparound care in testing.
And it's clear that advocates are calling for a lot more action from our officials. So what other steps does Canada need to take in order to help this growing number of people affected by HIV?
They need to step up their game. They need to invest more to ensure that the rising cases are reversed and we get down to where we were prior to 2016, where we were seeing decreases year after year. So that means investing in care and support to people living with HIV. It means having adequate access to medication and equity across Canada, which we don't have because we do not have a national pharmacare program, which the Liberals promised in 2015, which they have not delivered yet. So we need to step up our game, and we have to have more equity and more equitable access to many different things. But we do have some things to to really celebrate with U equals U, like undetectable equals untransmittable, which is a huge tool in our toolbox, which is somebody who is using their medications and continuously and reach undetectable cannot transmit HIV anymore. So, that it's breakthroughs like that that we have to build upon to reduce stigma to people living with HIV. And we also have to decriminalize HIV disclosure, which hasn't been done, which has been promised since 2015 from the same government.
It's clear a lot of work needs to be done. All right, Mr. Lacoste, we've got a quick 30 seconds left here, but what are you watching for next coming off the heels of the conference?
Well, what we're watching for next is to re-engage with Minister Duclos, as we've had some privileged space to meet with him during the last couple of days, and to engage in really meaningful conversations and also address the issues that have been holding them back from doing it. Why are they not investing in HIV in Canada? And I think that also is on the shoulders of the public health officials to respond to that.
All right, Mr. Lacoste, thank you again for your time today. The economy did not contract as expected in May, but stayed flat after a 0.3% expansion in April. Stats Canada says its preliminary estimate for second quarter GDP points to growth of 4.6%, up from 3.1% for the first 3 months of the year. This has several big bank economists predicting that we'll see another sizable interest rate increase from the Bank of Canada in early September. Well, with us now to unpack the GDP, interest rates, consumer debt, and the labor market is Dr. Jack Mintz, economic and public policy expert. Dr. Mintz, welcome back to Forum Daily.
It's my pleasure. Thank you.
So as we mentioned, the economy did not contract as expected, but instead it stayed flat in May. So can you unpack the significance of this for our viewers?
Well, I think we should remember the economy is slowing down. I mean, we can almost say that we've come to the end of the recovery, and the outlook, at least in the next while, is probably maybe some potential shrinkage in GDP after the spring. But certainly we're not going to be seeing the kind of growth that we've seen last year as we came back from the pandemic year, 2020.
And how does all of this relate to the issue of inflation?
Well, we still do have significant inflation. Job vacancies are very high. In fact, as much as there's a number of unemployed people in the economy, we have labor shortages. Lots of businesses are complaining about that, but it's resulting in higher wages to be paid, and the Bank of Canada is quite concerned about that. We've had some relief in terms of commodity prices lately. They've come off, but they are still relatively high compared to what they used to be. I mean, certainly when you go to the gas pump, it's less expensive today than it was a few months ago, but it's still, last time I looked, it was about $1.70 a liter. So that's still way up from what it used to be. So people are still feeling the squeeze in inflation, and inflation is still continuing when you take out gas prices and food prices. It's still at a relatively high rate, certainly above 5%.
And to add to that, some experts are predicting another big rate hike from the Bank of Canada to get inflation under control. So what would that look like?
Well, I think we'll have to see what the Bank of Canada will do on its next round. It certainly had two aggressive hikes recently. A point the last time, 0.75% the previous time. I suspect we're going to probably see at least 0.5 or 0.75 again, mainly because the economy is starting to slow down and commodity prices are starting to come off. That I think it might take some pressure off big increases in the interest rate, but also the bank has indicated that it wants to see interest rates around 3.5% to 4%. We're roughly around 2.75% for the policy rate. And so there's still a little ways to go to keep raising interest rates.
And bringing this back home to our viewers, how do you expect a higher interest rate to impact consumers, especially those Canadians who are already carrying higher debt loads?
Well, interest rates are certainly going to put some pale on the economy in terms of slowing it down. And that could lead to eventually some taking some pressure off wage increases. Well, people have been looking at 9-10% interest rates lately, inflation rates, and their wages have only gone up 5%. So people's real wages have actually been cut over the past year, and it's unlikely that they're going to make up for it, given the way that interest rates are rising, which means that commodities are more expensive, so people are buying less of it. They're deciding to cut back on particular products, because they still have to pay for gasoline, they still have to pay for food. So some of the other things like leisure and travel, people will think about not buying less of because they're going to have to pay for the necessities that they need.
All right, Dr. Mintz, just over a minute left here, but jumping to the issue of the labor market right now, as you mentioned, job vacancies remain high across the country. So what can authorities do to help fill these jobs?
Well, I think there's not a lot that could be done in the short run, but I think the governments, are going to have to pare back some of the support that they give for people not to work. The two biggest decisions are often made by people deciding to leave the working force, like retire early. And the other one is whether to join the working force. For example, women and also men these days who decide who have been raising children and come back into the workforce. That's a good example. Or people who've been on these extended unemployment insurance benefits who are unemployed that could be working as well. And I think the governments are going to have to do further work in paring back some of the benefits that we provide, which has been quite liberal, actually, in terms of the 2020 year, where a lot of money was poured out to help people cope with the pandemic. But some of those relief programs have been slow to come off.
All right, Dr. Mintz, sounds like we've got a lot to keep our eyes on. Thank you again for joining us today on Forum Daily.
My pleasure. Thank you.
Stay with us. We'll be right back. Before the start of the long weekend, groups representing paramedics warned that people who call for an ambulance in Ontario may have to wait longer for one to arrive. This is primarily due to healthcare staffing shortages and temporary emergency room closures, which were predicted to slow down the response times for emergency services. Ontario's health minister says the system is facing pressures due to the challenge of maintaining the required staffing levels. And this problem is not limited to Ontario, as staffing shortages are impacting healthcare systems across the country. Well, with us now to discuss the impact of these staffing shortages on paramedics in particular is Mr. Dave Dinas, president of the Paramedic Association of Canada. Sir, welcome to Forum Daily.
Good afternoon.
So let's start with how this long weekend was for paramedics amid these staffing shortages.
Yeah, thank you. So the long weekend traditionally is a very busy time for paramedics. We see lots of people going to enjoy the outdoors and recreating, which in turn creates more ambulance calls and requests for service. So normally it's a busy time in the summer anyway, but you couple that with the recent shortages and closures with medical facilities around the country, places an enormous strain on paramedic systems from coast to coast to coast.
And in addition to this, we know offloading delays are also responsible for tying up paramedics. So what exactly are offload delays and how long could these delays be?
Yeah, so an offload delay happens when a paramedic crew arrives at a medical facility, traditionally an emergency department, and the department is so overworked and with so many patients that they're unable to accept the patient from the paramedics, which means that paramedics have to stay with the patient, traditionally either in a hallway waiting for to be triaged and placed into a bed, or in some extreme cases that we're seeing now, we refer to ramping, where the patients remain inside the ambulance on the front ramp of the emergency department waiting to be triaged and placed.
And can these delays be seen across the country, or are certain regions more affected than others?
Definitely, it's a problem we're seeing across the country, as you can imagine, in larger urban and metropolitan centers around the country that are experiencing higher than normal call volumes, coupled with shortage in staff in both the paramedic system and the healthcare system globally. It creates this vicious cycle where there's just not enough staff to take care of the patients inside the facilities, and there's not enough paramedics to respond to calls for assistance.
So how are Canadian paramedics feeling amid these staffing shortages, offload delays, and the pressure from the job itself?
Yeah, as you can imagine, the last 2.5, 3 years have been a very challenging time for paramedics and paramedic dispatchers around the country, with obviously the COVID pandemic has placed an enormous challenge on the work that we do. And some jurisdictions in Canada, we've coupled that with, for example, in British Columbia, the opioid crisis, as well as the recent climate emergencies are all compounding on workload, stress, and burnout on paramedics. And then you couple this now with a staffing shortage, both in paramedic services as well as healthcare facilities. And it's really taking a toll on paramedics from around the country for sure.
And bringing this back to our viewers, how are all of these factors, these compounding factors, as you say, impacting patients and services overall?
Yeah, well, as you can imagine, if the paramedic crew is waiting at a hospital on an offload delay or is unable to staff an ambulance because of paramedic shortages, then that's one less ambulance that's available in a system to respond to people in their time of need. And prior to COVID, many systems in Canada are operating at or over 100% capacity to begin with. So anytime we add an additional strain onto the system, that translates directly into delays in responses for paramedics.
All right. Well, meanwhile, we saw these emergency department closures or reduced hours during the long weekend. Could you see this becoming the norm due to staffing delays?
Certainly, it's become more and more common in our experience around the country. With delays to access healthcare facilities, or in some cases, paramedic crews having to bypass a hospital to go to the next closest community because they are shut down. And again, that just adds to that pressure on the system, where if you take a paramedic crew from one geographic area that has to go now to another one in order to transport a patient to another facility, that's one less ambulance that's available to respond in that community. So it's definitely an ongoing issue. And without some immediate intervention, the problem is only going to get worse.
An issue that definitely needs to be solved by our officials. We'll definitely have to keep an eye on this situation. But Mr. Dinas, thank you again for joining us today on Forum Daily.
Thank you so much.
All right, I'm Nima Rajan, and that'll do it for your look at national and international news from this past week. For more news on demand, you could also follow us on our social media accounts and visit our website. Thanks for joining us on the Forum Daily Week in Review, and have a great weekend, Canada. We'll see you next time.